Okay, 8-1. Action.
Hello everyone, we are at the Apex BRC 2018 and we have here with us Professor Geoffrey Block, who's a big name in the field of CKD MBD. He's there on the KDCO guideline committee. He has done lots and lots of original work on cinacalcet. He was one of the prime authors of the EVOLVE trial. So sir, with all these changing evidence, what do you think should be the bottom line where we should be focusing while we are treating patients with CKD MBD?
I think first off, thank you for your complimentary words. I think the most important thing that we need to focus on is what are we doing for the patient, not for their laboratory values. This field has been dominated over the last 15 or 20 years by a focus on particular lab values and their abnormalities. And many people, nephrologists, are driven by a desire to get a particular lab value into a particular target. And much of what we prescribe to our patients is focused around getting labs into target. We're trying to shift the whole field into understanding what are you accomplishing for that patient? What are you making better? And honestly, the emphasis of KDIGO is on patient reported outcomes. What actual events that matter to patients are we making better? And our emphasis is on randomized trials that treat events or look at events, the effect of medicine on events, not lab values. So while lab values might help get a medicine approved by a regulatory agency, it's not what matters to an individual. So I would say that's the main focus of my message is treat the patient, treat the whole patient, don't treat a particular lab value.
Exactly.
Yeah.
And what will be the patient-related outcomes look like in CKD MBD?
Well, you know, honestly, CKD MBD affects all of the patient-reported outcomes you might imagine across the spectrum of how they feel, because hyperparathyroidism causes really severe bone pain, it causes joint pain. In fact, you know, an anecdote, when we first started developing cinacalcet, one of the very first people I ever treated with this medicine told me how much better she felt, like instantly felt better. Her bones didn't hurt when I reduced her, you know, when I treated her with cinacalcet. So we look at how people feel, we look at how much time do they spend in a hospital, how many hospital events do they have, how many days do they spend in a hospital, how likely are they to have a heart attack or a stroke or things that really matter to you and I. Stroke is devastating, right? Having a heart attack is devastating. And then we look at, as you might imagine, the sort of the big picture of outcomes, which is longevity. You know, what are we doing to make people live longer? We want them to feel better, be better. Hopefully we move our field towards functional measures, right? What can someone accomplish? What can they do in their day? Can they go back into the workforce? And we're moving there. You know, we're moving away from what we're doing to PTH instead of what we're doing to the patient. And my emphasis of all of my presentations here at this meeting have been, think about your actions and not just how those things you prescribe affect a particular lab, but how do they affect the bigger issue with what you're doing for that individual.
So rightly so, this is the year of patient-related outcomes, and that's what Dr. Geoffrey Block also thinks. And he's been loaded with caffeine today, and he's had a couple of cups of coffee, Coke in the last lecture.
4 talks for us
And
throughout the whole
4 amazing
BRC.
talks. He practice-changing talks and most applauded talks at the Apex conference. You must watch them. Please follow Divya's timeline to find these videos, and I have also posted one.
Thank you so much.
Thank you
sir.
so much.
Pleasure meeting you.
Thank you both. Yeah,
Thanks
I
a lot.
very much appreciate it.